Hey, everybody. Welcome to the Prep Life Podcast. This is your founder and CEO of Glam Girl Bikini, Amy Enger. And today I am joined by special guest coach, Drea. Welcome to the show,
Hello.
Drea.
Hey, thanks for having me.
Yeah, I should say welcome back because if you are a longtime listener, you know that the last time she was on, she was pregnant with her daughter who just turned
She
what?
just turned one in January.
Yeah, she's like the cutest human being in the entire world. Such a cutie. And so we did I think we did a postpartum and pregnancy kind of talk with you and a couple of other guests. And then we, in the OG, did one just kind of introducing you as a coach. And so we were just chatting right before we got on here. I think you've been with the company for almost 5 years now. Uh,
Yeah,
at the end of
right at
this
the
year, I
beginning.
think will be 5 years. And you were my client before we even started Glam Girl. And I remember you started out as a lifestyle client and you just said, I just want to get healthy. I'm not going to do a competition. And things kind of turned around once you kind of around the atmosphere. So just give us a brief catch up, I guess, on what you've been doing since you've last been on the show. And um, we're going to definitely talk about the newest venture that you and your sister have going on. So I'm super excited to have you on today.
Awesome, thanks. Yeah, so I obviously was on the post-pregnancy podcast episode and post-pregnancy. So I breastfed for an entire year and how there's so much misconception with, oh, if you breastfeed, you're going to lose a ton of weight because you're going to be burning more calories. I might be an alien or something because my body didn't respond that way, and a bunch of other
Oh,
people that I have talked to, that their bodies didn't respond that way. I kind of just see where I was, like, stagnant, like my body composition was changing with weight training, but as far as losing body fat, I don't want to say weight, I want to specifically say losing body fat was very difficult. And I already have, more of a endomesomorphic type of bodies where we always have to do insulin resets through food manipulation by doing higher fats, lower carbs. But even doing that while breastfeeding wasn't something that I could do because I had to have carbs in order for my body to produce milk.
mm-hmm.
So when I was finished breastfeeding, my sister, she is a doctor out here in Henderson, Nevada, and she was telling me about this medication called semaglutide, and it's Ozempic compound medication, and it's an injection that goes in your lower abdomen. And she's like, it helps with weight loss. Do you want to try it? Because that's how it works. Helps with a reset, an insulin reset. And I was like, yeah, sure. And so I was on that for 6 weeks and was down a little over 20 pounds with,
Sweet.
consistent, food and exercise and everything. So I was like, wow, this is the business. So since we use me as a guinea pig, my sister decided that, let's run a clinic like this because my sister already has a primary care clinic. So we wanted to, help other people with their weight loss journeys because it's something that we're both very passionate about. You don't just become a doctor just, you know, to become a doctor. Like, you genuinely have to care about people, same way as, you're not a fitness trainer or a competition prep coach. It's you genuinely care about people and want to see them hit their goals. So
Yeah.
it's just kind of nice to have both of our fields of study just mesh so well together right now.
I love that you guys and tell us what the name of your company is. I think that's really cool.
It's a Lightning VIP, and Lightning is our last name.
Yeah, you guys are so cute. I love that. So just to clarify, so to recap, you were breastfeeding for a year and then you kind of felt like you needed a reset. And I think a lot of people don't talk about that. Like you said, with the weight loss thing and breastfeeding, I had to be done breastfeeding before I started losing weight. And I love how you specified, losing body fat specifically because we can lose weight, but that might not be the right kind of weight, especially for our goals as physique competitors. We don't want to be losing muscle weight. So as far as that goes, like for me, the progestin, that hormone that helps you keep the baby alive, it makes the body's insulin resistant. So I think I think it's like people that are, like you said, they're basically aliens that lose a lot of weight while they're breastfeeding. I didn't see it. I had to wait for my goals until I was done with that goal. It's like a separate goal, right? You kind of have like, you're the food. And as your daughter would say, Baba.
Yeah.
I remember she called me Baba when I went to go visit her. I'm like, sorry, these Babas aren't working anymore. Um, she's so cute. But anyway, so yeah, so in 6 weeks you lost 20 pounds. So that's incredible. And then as far as like how you've impacted clients, I know you've helped so many people through our company. And then you wear a lot of hats there in Vegas as like a personal in-person trainer. And then how did you and your sister pair together? So she obviously prescribed and did like the medical scope of practice. So what things were you involved in that process of building this business, and how do you help the patients at the clinic specifically?
Yeah, so she did all like, the back work, the leg work. She already had a clinic running. So what kind of happens, how I tie in is me and my sister, we have like two completely different personalities. I can be such a people person and she is just very, straight to the point.
Mm-hmm.
Um, no customer service skills sometimes. So
The
I'm the
bedside
one
manner.
that's on the calls. Yeah, like I'm the one that handles, all the phone calls with potential new patients and everything, kind
Uh-huh.
of breaking down how our program works. But where my skill set comes in is when after they, selected whichever package they're doing, then that also comes with nutritional guidance. So on their entire, because our program is a 12-week program, on their program throughout the 12 weeks, they have my support from my nutrition standpoint. I have a bunch of templates made out for the 3 different body types: endomorph, ectomorph, mesomorph, that I give to patients. I kind of, can, because I've been doing it for a little bit, can look at someone a little bit and, kind of tell which category they're going to fit best into. Not
Uh-huh.
saying it's the only one they fit into, but the one that they most fit into. And I have like a grocery list attached with it, what the characteristics of that body type are, what the best style of training for their body type, what a breakfast, lunch, dinner, 2 snacks should kind of look like for their body type. So
Yeah.
that's where my skill set comes in. I have people that, text me nutrition labels all the time when they're at the store. Hey, is this good? I break down macros in the most simplified way for people. So I'm like, you can Google this information and you're gonna get like 50 different answers. So I've like just figured out to simplify it. So 'cause I believe that once you have an understanding of how macros work in the body, like it changes everything, like how you eat and how you choose to fuel your body.
Yeah. So let's go over those body types. I know we previously had a podcast, and it was a while back on body types. So you can refer to that episode that Chris Nicole and I did. But let's give like just a brief summary of like what that looks like. So you had mentioned earlier that you're a meso endo. So for people that don't know, you can it's pretty common to kind of be like a hybrid of two different body types. So for me, I'm an ecto endo. So I have a hard time losing body fat because of my hypothyroidism, but I'm also a hard gainer, which is an ectomorph. So a true ectomorph is more of just like how I was before I had hypothyroidism, where I was just completely skinny, like skin and bones, and had no muscle. And I could basically eat whatever I wanted. And then endo, it's just really hard to, they're usually higher in the body fat and it's harder to lose weight. So can you describe what the meso is and then how you fit as a hybrid of meso endo?
Yeah, so meso more so is that natural built athletic type of build already. Best way that I can explain it or describe it. So on my templates, I put cartoon characters so people can relate to it. Like ectomorph is, Rick from Rick and Morty and the sister from Daria. And I believe for the mesomorph, I have a Teenage Mutant Ninja Turtle and She-Hulk. So, a little bit,
So
but it works. People
bodybuilders,
get it.
basically. Yeah.
Bodybuilders, yes. So people, they get it. And for mesomorphs, it's going to be, easier to gain muscle.
Mhm.
Um, but it might be slightly a little bit more difficult to lose body fat, but not as hard as what it would be if you're like an endomorph.
Mhm.
So that's like the main body type for mesomorph, and I feel like with my fitness journey, I feel like I was a true endomorph, and my body composition and the category that I went into started to shift over more towards a mesomorph,
Yeah.
which is really cool to see somebody's body doing that, especially when it's your own body. Uh,
Yeah, well, you had no like previous athletic background. If you listen to her intro podcast, she did mostly marching band and really hadn't lifted weights until yeah, were kind of inspired on this journey and um yeah, so
mm,
I think that's really cool. So we could go on and on about like different types of foods that those body types could have and maybe we can do another podcast on that. But we've never done a podcast on semaglutide and I'm really this is like one of the new trends. I think a lot of people are looking at as pretty much a wonder drug for several reasons. So why don't you start? I know you kind of present some of these questions to your sister. So we want to make sure that, we're not doctors, we're saying that and that we're staying within our scope of practice. So feel free to differentiate like if you got this answer from your sister and obviously we're not going to be talking about like what types of like dosage people should be taking or things like that because that would be not like within our scope as well. But can you kind of just give a brief summary about what semaglutide does for people and what populations generally will really benefit from it and those reasons?
yeah, absolutely. So semaglutide is a GLP-1 medication, which stands for glucagon-like peptide 1. What it does is it helps stimulate the beta cells in your pancreas to help your pancreas produce more insulin. Now, there's other weight loss medications out there, one of them being metformin right now.
Hmm.
The main difference with those is metformin is going to drop your blood sugar, regardless if you're diabetic or not.
Okay.
And you're going to expel excess sugar through your urine. Whereas with semaglutide, it just expels the blood, the sugars, and it kind of like absorbs in your cells, so you're not excreting it out or anything like that. So
Okay.
that's how semaglutide works and what the difference is on there. Semaglutide also helps to decrease your ghrelin levels as well.
Okay. So it kind of makes like a shift in the brain in terms of that and kind of helps you process carbs better is what I'm kind of hearing you say. Uh,
Absolutely, 150% it does.
and using those for okay. So potential, I guess, benefits and potential possible side effects to be aware of if you're taking it. What are some of those?
Yeah, so this is also not a new medication. This has been around for like quite some time. I think it's popular right now because a Kardashian or something did it.
Yeah. Yeah.
But it's been around for quite some time with different providers and stuff using it for weight loss purposes. But one the benefits of it obviously is going to be if you're diabetic, it's going to benefit you greatly by decreasing your blood sugar.
Yeah.
And for it's also been approved for weight loss, has been for quite some time. So, yeah, sorry, I lost my place. I don't know what my phone just did something really weird. All right, there we go. Can you repeat that? What were the benefits and then what are the side effects?
Yeah. So some of the side effects to be aware of.
Yeah, some of the side effects, it's literally a Pepto-Bismol song. If you've got upset stomach, indigestion, then it goes diarrhea. But like those are the side effects of semaglutide. I sing it to patients all the time. It makes my day. Those are the side effects of it. So we usually, if patients do experience any of those side effects, take some Pepto Bismol. The cool thing about our clinic is if Pepto Bismol is not cutting it, then my sister, since she is a doctor, she's able to prescribe them medication to help um, to help with those side effects, and it gets sent directly to their pharmacy of preference.
Okay, that makes sense. And then, so since we're specifically in the prep life, we're bodybuilders. So I know that you in disease populations, obviously people with diabetes, you mentioned, I'm sure people with like metabolic syndrome and obesity and things like that can really benefit from this to get their health markers back. But in terms of like the bodybuilding world, have you heard about like bodybuilders using it? Is it beneficial to them as well? Kind of what are the parameters with that?
So I haven't heard much on bodybuilders using it,
Uh-huh.
but I have a very strong hunch that a lot of them are, and it's just one of those, industry well kept secrets or whatever.
Hmm.
Um, but it's not recommended for anybody with a BMI of under 25 to be on the medication.
Yeah.
It's frowned upon in the medical community. So that's probably another reason why, if bodybuilders are taking it, especially we'll go with, bikini athletes since they're the smallest ones in, the
Mhm.
bodybuilding world. And a lot of times, their BMI is going to be, below that 25, especially if they're in the fun size categories like myself. That's
Fun
class A
size.
and sometimes B.
For those of you
We'll
that don't know
call
what
me
fun size
queen.
means.
Yeah, so I'm sure that's why you don't want to ever make your provider look bad for supplying that. But in my opinion, I feel like for bodybuilders, it's going to be most beneficial to take it if they were to go down that route. Would be during a cut. Um, it can be used in improvement season too. But me personally, what makes sense in my head would be if you're doing like a little mini cut during your improvement season, then using it and then coming off.
Okay. Yeah, that makes sense. So what I guess there's a lot of literature out there, it seems like, that you can lose a little bit of muscle mass while on this. I know for metformin, for sure, that that's like a threat. Is it also the same for semaglutide, or what's kind of like the science saying behind that?
Yeah, not in the clinical trials did they see that. But that's also going to be dependent on that individual. Like, are your protein needs getting met how they should be? What is your
Okay.
lifestyle that you have also surrounding medication? Because a lot of people are calling it like this miracle medication, and I mean it works, but it works even better if you work too.
Yeah.
And you can't just expect to take the medication and make no lifestyle changes and expect to lose weight. Like that's too good to be true.
Yeah. And I mean, I've heard of people losing the weight, but in those situations, it's like they do gain it back. Or, if it's like a severely obese person, if they're not changing their lifestyle, and they probably wouldn't lose as much as they probably, obviously that they would if they were incorporating the nutrition and exercise part of it. So when you guys take people in on your clinic, do you get any kind of like pushback when people um like, are there ever people that are just like, no, just give me the medicine. Like, I don't want to do these lifestyle changes. Like, do you ever get that kind of pushback?
Absolutely, we kick them off for a program and refund their money. Nobody wants to deal with that headache.
That's funny. So they definitely have some teeth in the game then. And then as far
Yeah.
as, so does it help with, um, like if you're exercising and on a controlled diet, do you feel like sometimes you had mentioned like you get nausea and stuff like that. Do you find that people have a hard time getting like their protein goals met because they're not as hungry and because the ghrelin in their brain, since there's that shift in just like not feeling the hunger, do you ever find that people struggle to actually eat while on it? Or is that not really a thing?
Absolutely. I can see that like it being difficult to eat because even for myself at first it was difficult to eat. But the thing is with my background versus other lifestyle patients that we have,
Mhm.
um, understand the importance of making sure to get my protein in, especially on a medication like this. Because again, if I'm not properly fueled, I'm gonna run into the issue where yeah, now I am gonna start to lose some muscle mass and everything, which is something that I don't want to do. So I really encourage our patients to, get very comfortable being uncomfortable in order to, maintain the goals that you want to do. So I recommend a lot of, level one, first form, like meal replacement shakes, to start off there. But
Yeah.
eventually that side effect of the semaglutide does wear off. So where you're
Okay.
you're not having as much appetite suppressant because your body does adjust to it. It acclimates to it as you're on it. The longer you're on it, the more acclimated your body's getting to the medication. So your dosing goes up.
Okay.
So that will eventually go away though, like feeling like you have no appetite.
Okay. Yeah. I like the idea of just doing a protein shake. My ectomorphs that tend to need to eat a lot of food because they're hard gainers, I always have to give them kind of like those processed things like quick digesting in a way, just so that they can get something in. So they're not feeling like they have a lot of volume. So that makes sense that you would recommend that. I guess what other types of, and again, trying to stay within the scope of practice. So I know I sent some of these questions to you ahead of time and you asked your sister. So when she's like, as a practitioner looking for like blood markers, do you evaluate those before, and kind of like what things is she looking for in order to like see, if this fits for that candidate, or is it more just about the BMI, like the height weight chart?
Yeah, so we are specifically looking at the A1C. And the
Okay.
reason that we're looking at that is because, long story short, liability reasons. We want to
Yeah.
make sure that there are no underlying health issues, like a low blood count, for like anemia or any underlying conditions that we don't know of. So
Okay.
so the patient can't be like, oh, well, I started taking this semaglutide and this is what caused my, diabetes or my retinopathy to be even worse. They could be unaware if they even have that to begin with. So
Okay.
we do that just as a pre-screening, just to make sure there's no underlying conditions for liability reasons.
So do you do a
Yeah.
full metabolic panel where you not only just look at the A1C, which for those listeners that don't know what that is, it's basically like your last 3 months average of your fasted blood glucose. So I'm assuming you also take like fasted blood glucose, and are there any other markers that you look at as well, or?
We do a comprehensive metabolic panel, CBC panel. Yeah, we do those three ones.
Okay, cool. Um, do you ever find like, and you may not know the answer to this, but do you find that the do you do like a pre and post blood marker, so you kind of can see like how much the A1C improves or the fasted blood glucose? Do you see those changes?
Yeah, we do like every 3 months.
Okay.
After, because that's the end of the 12-week program, and a lot of people, they renew and everything.
Yeah.
So we have seen improvement there, which is really cool.
Yeah.
It's also kind of really cool to be able to tell someone who, may not have insurance or they don't have a primary care doctor, hey, you have diabetes, just so you know. So this is a really good medication for you to be on and to get you started off with.
Yeah.
So that's just really cool being able to help people, like not even just, aesthetically, but internally as well. So I'm really happy that my sister chose to go to school for all this,
Yeah.
and that we're able to
Yeah.
work together with it.
Yeah. It's so good when you take a holistic approach. And I think that modern medicine really needs to do that, where, a lot of times doctors don't even get a class about nutrition, and they're dealing with very serious issues, and they have to go through a lot of schooling. But we also need people in different angles taking care of the whole picture of that person. And medication is one thing that we can do, but we can hit it from all angles. And looking at nutrition and diet and exercise, all of that stuff is such a great comprehensive way of doing things. So I love that you guys paired together. um, are there any other lifestyle factors that you have to consider when you're evaluating whether or not they're going to be a good candidate? I don't know how rigorous it was where
Mhm.
they have to kind of like show you. Do they have to kind of say that they're committed to also following this program? because you had mentioned like they kind of get kicked out. So I didn't know if that was
Most
like
definitely. We've kicked
a
several people
screening.
out. Yeah, it's we when I talk with someone over the phone, I can kind of get a sense of where they're at, what their level of 1 through 10, how willing are they to, how much do they want to lose this weight,
Yeah. Yeah.
so it's a willingness factor that goes into it. Are you willing and ready to change over your lifestyle? And like I said before, get comfortable being a little bit uncomfortable while you're going through this. So those are the main things that we look at. We actually
Yeah.
had a one of our patients. She was wheelchair bound, and she was still losing weight. I had actually written workouts for her to using towels. So you can do like a bicep curl by pulling the towel apart and then curling, and you're still going to get that tension on the biceps. We were using bands, all sorts of stuff, and so she was moving what we could move,
Yeah.
and she was losing weight. So I tell everybody, I was like, I don't want to hear
No
any
excuses.
excuses.
Exactly. So what are some of your best client testimonials? Because when did you guys open? How long have you been in business?
I believe my sister got the licensing and everything. I want to say like maybe November of last year.
Okay.
But we didn't actually launch everything until maybe February of this year,
Okay.
February, March of this year.
So
But we have,
you've had people go through the 12 weeks then, probably
oh
like
yeah,
several
oh
groups.
yeah, and
Yeah.
staying on. Yeah, one of our patients, she's been on it for, this is her maybe like 14, between week 14 and 16,
Yeah.
and she's down over 60 pounds, which
Whoa.
blew my mind. My sister called
No
me and she's like,
kidding.
look at the charts. And I was like, oh my gosh. And then I
Wow.
saw this patient, completely different person,
That's
completely
mind
different
blowing.
person.
What do these people say about it? What are their thoughts like when they have that extreme of weight loss? I mean, what do they say? Because I'm doing the math right now. That's 3.75 pounds a week.
Yeah.
It's a lot.
Um, a lot of them, I feel like it's an adapting thing for a lot of them, actually. I think that they're shocked themselves.
Yeah.
I always warn everybody, start saving money now because you're gonna need to buy a new wardrobe.
Hmm.
So
Yeah.
yeah, a lot of it is shock with a lot of our patients. But also, they're very thankful because a lot of our patients that come to us, this is not the first thing that they've tried before weight loss.
Hmm.
Um, and a lot of them just need a little bit more understanding, just on macros and how food works in the body, and also this medication with it being able to do an insulin reset for you, like it just makes it, so much easier.
Yeah. So we see like a lot of the spas and clinics and things are and hormone places, like they're all kind of popping up and selling semaglutide and advertising that. At least I've seen that quite a bit recently. So
Yeah,
how do you know? I know we've talked offline about just
word of
how if it's a certain price, it's probably not legit. And can you kind of talk about that a little bit? Some things to look out for when it comes to choosing the right person? Because I know you can service Nevada, but I think your sister's only licensed in certain states. Is that right?
yeah, she has about, I want to say about like 10 other states that she's licensed in. You can like go on the website lightningvip.com, and it'll show
Okay.
all the states that we're able to like ship to and stuff.
Uh-huh.
Um, but no, yeah, so semaglutide, like I said at the beginning, is a compounded Ozempic. And the difference between Ozempic and compounded Ozempic semaglutide, I give this analogy a lot so people can understand it. Say you're at Walmart and you're going for ibuprofen. You see the ibuprofen on the shelf for $4. You look one shelf below. There's the equate version, same exact active ingredient, but it's $2 cheaper. That's the difference with it. It's a name. It's a name brand type of thing. And
Okay.
so copyright, that's where they come up with the compounded portion of it. Some pharmacies will add different components to their semaglutide, like
Hmm.
different vitamins and things like that. So and it can really dilute the product itself. So
Okay.
that's why they have different pricing at different places. Because it's kind of like the strength of the product
Mm-hmm.
is what you're looking for. But our product,
Okay.
top
It's
notch.
100% legit. It's VIP, baby.
It is 100% semaglutide. Yeah, but it doesn't have anything else added. We offer, you know, vitamin B12 shots or lipo separately from our packaging and everything. So it's just straight semaglutide.
Yeah. Okay. And so when these spas and things, I'm assuming that they have to have some sort of medical practitioner involved in that prescription, correct? Like it's only something that you can get from a doctor. Is that right?
Yeah, usually they have even at medical spas and stuff, let's say they don't have a doctor there, they always have an overseeing doctor that may
Okay.
not be on site and things like that. It could be a virtual thing where they just partnered with a doctor and that doctor, you know, sends them a prescription and stuff like that for their
Okay.
patients. It can be all sorts of different things.
Yeah. So how many do you have to take months off? Is there only a certain amount of time that you can follow it? When you say 12 weeks, I know there's different titrations because your body kind of becomes like resilient to it. Is there uh I mean, it's probably different for everybody and it's probably more of a doctor thing to like individualize that, but is there
Mhm.
a set where you have to take a break or is it kind of you can be on it for a while?
No, not at all. You can definitely be on it for a while. I actually had a girlfriend back home in Indiana who had amazing weight loss with it, and she was on the medication for like 2 years.
Oh, wow. Okay.
Yeah.
Okay. So you just aren't to that point, obviously, since you've just started, but your longest patient has been 16 weeks. Is that right?
No,
This point?
we've had a little bit longer. We've had people going into like their third cycle now, so like around like 32 weeks and stuff.
Oh, okay. Okay. Well, you've been a wealth of information. I've learned so much, and I hope our listeners have too. Was there anything that you wanted to talk about before we hop off, or a question maybe that I didn't ask you in regards to all of this that you'd like to share with everybody?
Yes, the one thing on there is I've heard this so many times from so many people's primary care providers. Well, my doctor said not to get on this medication because I'm just going to gain the weight back. You will gain the weight back if your lifestyle is not in alignment with what your goals are.
Yeah.
I myself was on it for like I lost a little over 20 pounds after 6 weeks and I stayed on it for like another 2 or 3 weeks. I haven't had that medication in well over a month and a half now.
Uh-huh.
And I'm continuing to still, you know, drop weight and retain and maintain muscle tissue and everything. So I know it's possible because I did it.
Yeah. And I know I've had some circumstances where clients like have shared that their doctor tells them not to exercise and things like that. Why would they do that? Do you know? I mean, obviously that's not the practice that you're
Because
um
oh yeah, see, I'm not gonna go into conspiracy theories and big pharma or anything, but something around there because you know doctors get paid off of you know different medications and stuff like that.
yeah.
And also I think a lot of it is ignorance. Like you hit the nail on the head earlier when you know, most doctors don't know anything about nutrition or workouts. I always say this jokingly to my sister, but it's pretty true. People in the healthcare profession are so wonderful at taking care of other people, but really struggle with taking care of themselves.
Yes.
So it's yeah,
Yes.
so that's why.
Super
That's why.
prevalent. Yeah, it's my sister's a nurse practitioner and she, doesn't she'll skip eating meals and like workouts because she's working like 12-hour shifts and has so much paperwork and they jam in like patient after patient and it's like she doesn't even have, some of these nurses don't even have time to like take a bathroom break or be able to drink water and things and it's just
Exactly.
really sad because those are the people that are so nurturing and so giving of themselves that, it's unfortunate that it's like the opposite. And it seems like they always have like these crazy treats and things in the break room and it's a stressful job. So yeah, I feel bad about the healthcare system in that regard. I wish they allowed for them to take care of themselves as well so they could pour into their patients, but that's a whole nother
Exactly.
topic. So, okay, well, can you share with everybody like where to find you? I'll put it in the show notes. So if they have questions, like if they're in the area and they want to reach out, or if they want to sign up for coaching with you, they can always go to glamgirlbikini.com and hit the get started button and just be sure to request Coach Drea. But kind of give us like your Instagram handle and other ways to find you.
Yeah, so my Instagram handle is just Coach Drea Training. You can also catch me over at Lightning VIP on Instagram. And we have a contact button. It has a number. It's my second phone, so got a second phone. It receives text, so of course, if you have any questions or anything like that, you can send a text, give a call, email,
Nice.
whatever works best for you. To see the list of states that we service, just visit our website, lightningvip.com.
Awesome. Well, thanks for coming on today. And if you would like to,
Of course.
give Drea a shout out and tell her how much you appreciated this, be sure to tag us on your Instagram story. We're at Prep Life Podcast or at Glam Girl Bikini. And we would totally appreciate that. We'll also link in the level 1 that she mentioned. So if you want to get some level 1, we'll show the link there in the show notes as well. So this is your founder and CEO of Glam Girl Bikini signing off. Thanks for listening, guys.